Hi, everyone. Today I am talking with Dr. Brian Abert with Vista Eye Care. So thank you for taking a little time out of your busy schedule so we can talk about Dr. Contact Lens.
Of course, my pleasure. Thanks, Brianna.
So what was your contact lens sales process like before Dr. Contact Lens?
I think it was basically, present to the patient while they were in the office physically, and then if they didn't purchase contacts at that time, just kind of hope for the best, hope that they would call us back, hope that they would come back in. Um, we would also reach out to those patients that hadn't ordered contact lenses from us for their year and see if they wanted them still. It was very hands-on.
So you were managing that through spreadsheets, or were you utilizing another system?
Yeah, it's pretty much spreadsheets. I would just kind of keep a list of all the patients seen, by me and the other doctors. And, if they'd ordered their gear supply, then that's great. And if they hadn't, we'd develop these lists and then we would give that to the front desk to call them in their downtime to see if patients wanted to order.
So it sounds like the beginning when you were doing it was really staff heavy, of potentially not a big return for the time that it was taking.
Definitely.
So describe the process of implementing Dr. Contact Lens. What roadblocks did you face with your staff, and how were we able to support you in that phase?
I think the biggest road roadblocks would just be you're learning a new thing, you know, another login, another password, another, I mean, staff, in every everywhere in the industry, everyone wants to have their own, um, you know, login and their own system that every company and group has developed. And I think with Dr. Contact Lens, it was, you know, like from what I had heard about using Dr. Contact Lens, it was going to be worth the effort, and it wasn't, it wasn't that hard to kind of get going.
Great.
The important thing is just end of the day having the staff make sure that all the patients receive um, their invite, and it's just part of the day now. It doesn't take very much time, and makes things run nice and smooth.
Describe Dr. Contact Lens from the patient's perspective. So now that you've been utilizing the system for some time, are patients coming in, and this is obviously a reflection of how you run a busy, successful practice. So are patients loving what you're presenting? Have they said anything about Dr. Contact Lens? How are your patients engaging with the software?
It seems to be pretty seamless. I don't think a patient has ever, I mean, to my knowledge, they've never mentioned Dr. Contact Lens. It's just, it's marketed as our practice, and it's um, getting people to, saves patients the hassle. They can easily purchase contact lenses. It doesn't involve, it's not staff heavy on our part. It's just, kind of makes things nice and simple for everyone.
How does Dr. Contact Lens support the way that you deliver eye health care to your practice and your patients?
Well, I guess it's, we're stuck in a world of, managed care, and our practice is very much, vision plan. We have a lot of working age folks that have vision plans and like to use those benefits as they should. And this just kind of creates, um, the opportunity for patients to easily get their year's supply. It gives us the opportunity to, you know, to to make a living.
How has Dr. Contact Lens changed this very staff heavy process now, and now changed your practice for your staff to better serve your patients?
Our staff are so talented and kind. There are just so many things that I would rather have them do than a bunch of busy work. And this gives them the chance. They just kind of oversee Dr. Contact Lens. Dr. Contact Lens works its magic and gets people their contact lenses. At the end of the month, we just get a big fat deposit, and it kind of it's pretty easy.
When you were looking for a system like Dr. Contact Lens and you were exploring other things out there, what brought you to Dr. Contact Lens?
I mean, I like that, we've always enjoyed working with you. You've always, as owner of the system and a working optometrist yourself, it's just I felt like I could really easily connect with you, and the same struggles that I have to deal with every day, because it's probably the same in Florida as it is in Colorado, right? Like, it's pretty similar stuff. We looked at we considered other systems, and some other systems, that are, managed by a single company, we would be limiting ourselves to, brand A and B and C's um, system, whereas Dr. Contact Lens incorporates all the big four brands. Most of the contact lenses that are prescribed to our patients, they can, as part of that program, they can easily get them.
Why is that important for the success of your practice in the future?
I think that's important because, we want to try to simplify things. We want to simplify things for the patients and our staff. Having one, contact lens management system like Dr. Contact Lens, lets us reach out to every patient, as opposed to kind of piecemeal. Like, you'd have to look in the chart and see, like, oh, well, they're using this particular brand, so we have to use this system. And that's just not practical. That kind of erases the point of it.
So if you were to refer Dr. Contact Lens to one of our colleagues, what would you say?
So I'm going to get up on a little soapbox here, because this is something near and dear to me. We have these other companies that are trying to get patients their contact lenses, and they're these giant companies with these huge resources available to them. And, we're not a chain. We're just we're a mom and pop shop. I'm the pop. We just don't have the resources that can compete with these other really large companies. And what Dr. Contact Lens does is gives us a really sophisticated internet-based tool that allows contact lens purchases to be done, correctly by patients, and easily by patients. So now patients can get their contact lenses, and we can sell them those contact lenses and still offer the conveniences that some of these really big companies were kind of traditionally only able to offer them. I don't know programming. I wouldn't even know how you would set this kind of thing up, but, interacting with our office software, all these things just make it really easy for us.
So when you're looking for new tools for your practice, because this has not been the first software you've implemented, how easy is it for you to get your staff behind your vision, and why at the end of the day is it important for you as the owner of the practice to keep moving forward?
I think it's important to move forward. We're the tides are constantly shifting in the healthcare industry, and certainly within eye care. If you're not, you have to be able to adapt to changes as they happen in the marketplace. Like, just 25 years ago, the internet wasn't even a widespread thing, wasn't even a source of commerce. And we're in a world where, everyone's walking around essentially with a pocket computer in their smartphone. Like, you have to be able to adapt to that, because, like it or not, patients are going to adapt to that. Your younger patients are going to be hip to, to ordering platforms and other ways to fill their contact lens prescriptions. And if we just kind of kick back and try to coast on how things have been done the last 50 years, we're going to kind of fall by the wayside.
If you could sum up Dr. Contact Lens in one word, what word would you pick?
If I had to sum up Dr. Contact Lens in one word, I would say alliance. I like the alliance that we have with Dr. Contact Lens, because it's a company that's run by an optometrist that's helping us help our patients see.
That's amazing. Thank you so much for sharing us with your practice and a peek behind Dr. Contact Lens with what you have experienced with your patients. We truly appreciate it and excited for your continued success.
Well, I appreciate all the help that Dr. Contact Lens has given us and you personally, and it's a pleasure working with you. I'd recommend Dr. Contact Lens to any private practice.